Hi guys, you're welcome. In today's video, we shall be discussing what I term importance of medical screening and checkup. Medical screening and checkup is a routine that is expected for an individual to carry out either quarterly or annually in order to assess the stability of their health and their total well-being. It has been discovered that a lot of people have not been conversant of this in terms of the knowledge, in terms of advantage, and in terms of the procedure and the steps that are required in doing so, hence the need for such a video as this. In the course of this video, I'm going to show you the importance of medical screening and checkup, the basic investigations that will be required to be carried out in the course of medical screening and checkup, the questions that you need to ask your doctor or caregiver while carrying out medical screening and checkup, the general examinations and physical examinations that will be expected to be carried out on you. The knowledge of such screening and such investigations and physical examinations to be carried out by an individual will go a long way in helping them out in preparation for the screening, as well as in being cooperative in the course of the checkup. So let's proceed. What do you understand by medical checkup? Medical checkup is a process of healthcare which involves physical, mental, and clinical examination whereby a medical practitioner examines a patient for any possible medical signs or symptoms of a medical condition. What this means in essence is this: is a checkup that involves a thorough physical examination of an individual by a medical practitioner, either by your doctor or your health caregiver, whereby the individual pays total attention into discovering those hidden signs and symptoms that naturally wouldn't have been discovered by a patient or by the individual coming for such examination. This actually emphasizes the need for such to be carried out by a medical practitioner, because the medical practitioner have been trained to discover those signs that naturally wouldn't have been discovered by a non-health practitioner. So what does it mean to do a checkup? What it means to do a checkup simply entails two major things: physical examination, medical and clinical examination. I'm going to explain to you what I mean by medical and clinical examination, which involves the laboratory investigations that will be carried out. What is physical examination? Physical examination is a routine examination that your primary care provider, your doctor or your healthcare provider performs to check your overall health. The examination is also known as wellness check. You don't have to be sick before this is carried out, such that you don't have any form of complaints or any form of observation on your body, but just to assess your wellness in those areas that naturally you wouldn't have known, or those areas in which the symptoms have not manifested. Hence, the need for such to be carried out routinely. What is physical examination? Examination can be a good time for you to ask your primary care provider questions about your health or discuss any changes or problems that you have noticed. There are different tests that can be performed during this physical examination. However, the test will depend on your age, your family history, or previous medical history that you have had as an individual. We are going to highlight those examinations that are to be carried out in the course of annual checkup, and those examinations could be peculiar to your age or your gender. What are the scopes of physical examinations to be carried out? Like I stated earlier on, physical examination involves a thorough examination of the total body from the head to toe, and it is being carried out by an healthcare practitioner, so that those practitioners have been trained in those areas to look out for and those signs to look out for, which naturally wouldn't have been discovered by an individual that is not an healthcare practitioner. And it includes a general check, which involves your blood pressure check, your body mass index check, which is the ratio of your weight to your height in square, your body temperature check, and it involves the systemic examination. What we mean by systemic examination is that the healthcare provider is going to examine all your body systems one by one, starting from the cardiovascular system, the respiratory system, the gastrointestinal system, the urinogenital system, which involves the genital area, and also the musculoskeletal system and the nervous system. All these systems will be examined one by one, and all the necessary signs are going to be elicited for any form of abnormality or stability. So this is meant to be carried out by a trained individual. A general practitioner can carry this out, a specialist can carry this out, depending on the location and the healthcare facility at which you are carrying out your annual checkup. The other thing that is going to assess is also the optical component, your sight. Your sight is going to be checked for any form of refractive error or any form of visual impairment. At times, for some people, they might have certain refractive error and may not be known to them. In the course of this physical examination, is going to be checked and is going to be detected if there's any form of such at all. What is the medical examination and investigation? I mentioned earlier on that general checkup or routine checkup entails two major things: the physical examination, which includes checking out for those things that can be seen physically, and laboratory or clinical investigation. Clinical investigations entails carrying out laboratory investigation. It could be a hematological investigation, has to be carried out on your blood, radiological investigations, or chemistry investigations, which involves all the MCS and microscopic culture and sensitivities that are going to be carried out on certain fluid from the body system in order to discover those things that cannot be seen with the eyes, but that are hidden within the body. Hence the need for such clinical investigations to be carried out. This goes further to show you what can be seen by physical examination. It is specific in outcome because it gives us detail which cannot be gotten by physical examination. It reassures and also confirms the information gotten during the physical examination. The investigation can be done depending on the age and gender. I'm going to highlight examples of those investigations that can be done for certain age group and for certain gender. What are the scopes of medical investigations that are general, that can be done by both gender, male or female, and across age group? We have general investigations that are expected to be carried out. The blood sugar is essential. Urine analysis is essential. Full blood count is essential. The ECG, electrocardiogram, is essential to know the electrical activity of the heart. Chest X-ray is essential to know the functionality of the lungs. Liver function test is essential. Kidney function test, electrolyte urea and creatinine, which is the kidney function test, is essential. Lung function test is essential as well. The lipid profile is also essential as the general investigations to be carried out in an individual. What are those specific investigations to gender? For male, it is essential that a male of 35 years and above carries out prostate-specific antigen test. Is a blood test that helps to know the level of the PSA. The PSA is actually the functionality of the prostate of an individual. So it actually helps to assess the functionality of the prostate of an individual to know if there's anything happening within the prostate of an individual or not. Prostate scan is also essential for male. For female, breast scan is essential. Cervical screening is essential. These are specific investigations in addition to the general investigations that I've mentioned earlier on. In the part 2 of this video, I'm going to be showing you how to prepare for a medical checkup, a medical screening, those questions you need to prepare, those things you need to have handy in preparation for the checkup. I would love that you watch out for that video and you watch that video in addition to this. If you are yet to subscribe to this channel, kindly click the subscribe button, share the video, and let me receive your comment for any form of feedback you want to give me as far as healthcare is concerned. Thank you very much.